Can you say, "This is Dr. Amanda Zelechoski"?
Why do we have to?
Just try it.
Oh, I can't.
Deep breath. Okay.
This is Dr. Amanda Zelechoski. Lindsay Malloy.
Now, wait, say Dr. Lindsay Malloy.
Dr. Lindsay Malloy.
No, come back.
This is Dr. Lindsay Malloy. Welcome to the Parenting Podcast.
One more time.
And then after that, can we have a candy flip?
No.
Please, Mommy.
Okay, ready?
Pandemic Parenting Podcast.
Excellent.
Welcome to Season 2 of the Pandemic Parenting Podcast. I'm Dr. Amanda Zelechoski. My co-host, Dr. Lindsay Malloy, is away on a much-deserved research sabbatical, so I'm going to do my best to hold things down for the both of us on this season of the podcast. Back in 2020, Lindsay and I founded Pandemic Parenting in order to share science-based research and to help all who care for kids navigate this challenging time together. Researchers around the world, including Lindsay and myself, have been hard at work researching the impact of COVID-19 on children and families. We've tracked more than 200 of these studies being published, and this season, we're going to discuss many of the direct implications for us parents. So let's dive in. Please note that the information contained in this podcast and on the Pandemic Parenting website are intended for educational purposes only. Nothing discussed in this podcast or provided on the website are intended to be a substitute for professional psychological advice, diagnosis, or treatment. No doctor-patient relationship is formed between the hosts or guests of this podcast and listeners. If you need the qualified advice of a mental health or medical provider, we encourage you to seek one in your area. When the pandemic lockdowns first went into effect, all of my internal alarm bells were going off. As a psychologist, I was deeply concerned about what the isolation and school closures would mean for vulnerable children and families. As a parent, I was worried about how my children would be affected by the sudden loss of their social and community connections and routines. We thought this would be over in a matter of weeks, but as weeks turned into months, my concerns definitely intensified. So one of the ways I coped early on was to dive into conducting research. And the question I explored was, how is the pandemic impacting the mental health of parents and children in the U.S.? In our very first pandemic parenting webinar, I shared some initial findings from that study. I wasn't surprised at all to find out that I wasn't the only one who apparently channels their worry and concern into research. Researchers around the world were asking similar and related questions and collecting lots and lots of data. Some of these questions included, what was the impact of the pandemic on mental health, both short-term and long-term? Which communities experienced the most negative effects of the pandemic? How can we better support these communities and the entirety of our society when disaster strikes next? I sat down to talk with two scientists whose research dug into these questions and whose findings highlight the uneven effects of the pandemic for different groups. First, you'll hear my conversation with Dr. Lara Aknin. Dr. Aknin is a distinguished associate professor of psychology at Simon Fraser University, former fellow with the Canadian Institute for Advanced Research. She's the editor of the World Happiness Report, and most relevant to today's episode, she's the head of the Lancet's COVID-19 Mental Health Task Force. I also spoke with Dr. Simona Skripkauskaite, who you'll hear from in the second half of the episode. Dr. Skripkauskaite is a postdoctoral researcher at the University of Oxford, and she's been hard at work on the Oxford's Cospace study, which stands for COVID-19, supporting parents, adolescents, and children during pandemics. She's also been working hard on the Oxwell Student Survey. When the pandemic became an increasing reality across the globe, the Lancet, a well-known publisher of several science journals, invited researchers to create task forces. Each task force focused on a specific area of research. Our guest, Dr. Lara Aknin, heads the Lancet's COVID-19 Mental Health Task Force. Dr. Aknin, along with mental health researchers with backgrounds in psychology, medicine, economics, and various other fields, worked together to review evidence-based research being published.
The way I see it, and there was probably a little bit of subjectivity and interpretation in what we were asked to do, but what I thought was important was to first kind of document and maybe collate our understanding of the data of what was going on. One really exciting feature I think, of the early days of the pandemic was just how quickly scientists tried to understand what was going on in the world and how they could contribute to this large global problem, which was really lovely to see this quick mobilization. And I think really a pretty pro-social atmosphere where people were sharing their data and putting out preprints as quickly as they could. And so I thought one of the key things our task force could do was to try to collect and collate and maybe synthesize what was going on, with a particular focus on what we thought was the highest quality evidence. And that will lead us to the paper that I think we're talking about. But our other main goal or contribution was to try to offer, in light of what we were seeing and in light of what we saw, offer some recommendations to help ease the mental health burdens that we were seeing in the literature and obviously in our daily lives, but also think about, what we could learn from this pandemic moving forward. I think, and maybe this is a message we'll circle back to as well, but I think the pandemic really shone a spotlight on mental health. It was receiving more attention then and in the early days of the pandemic, maybe than it had before. And so really trying to think about and capitalize on, this opportunity to maybe how can we build mental health services in a way that is better prepared to preempt these problems in the next time a pandemic or crisis emerges, and even without those external pressures, how can we support people?
Yeah, so let's get into it. The sort of main product, I guess, that came out of all of this work by this incredible task force was a paper entitled Mental Health During the First Year of the COVID-19 Pandemic, a Review and Recommendations for Moving Forward. So talk to us a little bit, maybe help break down kind of what was the research process there for people who maybe aren't immersed in the research world.
Yeah. So the process was a really interesting one. I've worked with large authorship teams before, but never a group of like 15 experts in all parts of the world where we were all meeting on Zoom. And it was really lovely. I really respect and admire everyone in the group, and the Zoom calls were really lively. And it was in the early days of Zoom, as you can imagine, everyone was learning to mute and unmute themselves. There were a lot of faux pas. It was a lot of fun. But yeah, once we decided that our first attempt would be to really try to document and understand what was going on, we had a couple early Zoom calls where we decided, everybody was going to kind of scour the literature to try to pull in and incorporate and summarize and send in the best papers that they could find. To a certain extent, we had to be choosy because there was an explosion of research that was coming out at that time. And, we were searching all the major search engines to try to make sure we weren't missing anything, but there were also papers that were coming through our networks. There were papers that we were reviewing. And so there was an information overload. It was coming from every which channel. And so what our group decided to do after prioritizing that we wanted to kind of document what was going on, we decided, I can't remember the exact time frame, but that we would all take a month and just try to collate all the papers we found. We had a major Dropbox folder where everyone was putting in the papers. One of the collaborators on the paper, Emily Thornton, was a student at the time, was collecting them and organizing them in a major master file. We were summarizing them, and then we all met once we had this prepared large kind of library, if you will, to kind of prioritize which were the papers that we thought were like of high quality and reliable. And we kind of talk about what that is in the paper, but really we were looking for large studies, not particularly small samples, because we were trying to get a broad understanding of what was going on. So large samples, those that were representative in nature, so those that did a good job of capturing their local environments or broad environments, and those that were rigorous data collection. And that might take various forms, because there was no way we could possibly synthesize like 700 papers. We had to pick those that we thought were the most informative for the question at hand. And so once we distilled it to probably what was about 100, 150, 200 papers, we started synthesizing and kind of extracting these main messages, and then prepared the lit review as you see it.
So you ultimately opted to do a sort of synthesized literature review. What is a literature review?
Yeah, so a lit review is basically one paper that tries to pull together and summarize existing work to hopefully offer some higher order conclusions and key messages that emerge across multiple papers or pieces of evidence. What it does do is kind of offer it's like a summary. It's like a Coles Notes or an executive summary of what you might see in other work. What it didn't do, and I think what some people both, in multiple places may have found a little bit frustrating, but I don't think we were there yet. We weren't offering new data. We didn't have, a large survey that we were exploring and analyzing and extracting from. What we were doing was pulling from papers and trying to understand what was already out there. It really is a summary of what already existed. It wasn't a new contribution through new research. It was a new contribution by summarizing what was already out there.
Yeah, and distilling across so many perspectives and samples and, research questions. What are some of the major takeaways at that point? So let's kind of get into that. What were some of the key takeaways from this process and doing this review?
Well, maybe it's helpful if I back up and just mention two quick things. One is the nature of the data that we kind of focused on in this particular lit review. And I think that sets the stage for the key findings. So we decided there are many facets and different constructs and ways to measure mental health. It's kind of this broad umbrella term. There are many components. Based on what we found in the literature, where we thought we could make some firmer statements, I think of it as almost four buckets, four kind of topics we could discuss. One was psychological distress, which is this concept that really captures anxiety, depression, and feelings of stress. I think psychological distress is a pretty appropriate label for that category. Related to that was another category. It's not exactly under the umbrella of mental health, but it's a very close correlate to that, which is self-harm. So intentionally hurting oneself through physical harm, or we also included thoughts of suicidal ideation and suicide. The third bucket was subjective well-being, which is these positive and negative emotions in people's evaluations, life evaluations as a whole, which is normally my key focus of study. And then the fourth kind of bucket, if you will, or the fourth variable we considered was social connection, or its flip side, which is loneliness. So to what extent people felt connected or psychologically distant, like weren't getting enough social contact from what they would have desired. So those were kind of our four key outcome variables. And we scoured the evidence out there to try to understand how these constructs were changing over time through the pandemic. And we used lots of different sources of data, some of it that kind of looked at what we call how people were doing at various time points, so cross-sectional data, so surveys that just happened to have occurred before the pandemic, and then surveys that occurred during the pandemic. We could compare those if they were, reasonably comparable groups, or what we call longitudinal surveys, which are surveys of the same people over time. And each of those types of evidence have their own strengths and weaknesses, but when we see consistent stories or emerging themes across the two key types of evidence, we can have some pretty strong sense of what's going on. So what did we find for these four different outcomes when looking at these different types of evidence? What we saw was for psychological distress that there was a clear uptick in the early months of the pandemic. In almost every study, in almost every place where there was data available, we could see anxiety, distress, depression rates were going up, both in terms of just overall levels and proportions of the population who were now above thresholds. Interestingly, at least over the first summer of COVID, though, these levels seem to did decline. In some places, not everywhere. They even declined to pre-COVID levels, which is a bit of a shock. I don't think, I wouldn't have anticipated that. Truth be told, I think when all of us sat down to look at the evidence, we just expected that we would be cataloging an avalanche of terrible findings, of just horrific stress levels high, everything kind of off the charts. And so while we weren't really surprised by this huge uptick in the early months, I think we were pretty surprised to see some evidence suggesting that in some places and in some samples, and not just one or two, but like a pretty clear return to baseline, or certainly a decline over time. So psychological distress seemed to go up and down, and there were some subsequent peaks and troughs as the landscape of COVID kept changing. Meanwhile, self-harm was one where, it's not easy to track this very clearly over time. Originally, we thought that we were quite worried to see that there would be a huge increase in self-harm rates. Some samples did report higher levels of self-harm, but there wasn't a clear, overwhelming pattern of it. In fact, I think one of the most striking and memorable papers, and perhaps one that I think is, if I had to point to the literature at the time, it's a paper by Perkis et al. That kind of looked at suicide rates and where they were relative to what we would have predicted given trajectories over time. And it showed that in the majority of these 21 countries, most of them, I should say, were relatively wealthy countries. So take that as a kind of a caution. Overall, we saw no clear rates of suicide increasing over time up through the first kind of several months of COVID, which was promising because I think, again, our intuition was that this was going to rise. But at least at the time, the current evidence suggested that that wasn't the case. Subjective well-being was surprisingly stable, although momentary emotions did move as we would have expected. Like people weren't as happy as they were beforehand or were reporting as such. People were more sad and more anxious. Life evaluations hardly changed. They almost did not move at all from pre-COVID to 2020. And actually, again, in 2021, the World Happiness Report just came out last week. And again, shows very little change in life evaluations, which was also a surprise. And then social connection and loneliness also showed a surprisingly robust stability. So some data sets did show an increase in loneliness or a drop in social connection. It's non-negligible, I guess I should say, but it wasn't nearly what we would have expected. I think given that so many people were isolating in ways that they had never done in their lives before, missing birthday parties, foregoing family dinners, weddings, all these things, and if you recall back to the early months of COVID, I remember staying home and like stepping away if I saw people come down the sidewalk. I had never been so isolated before. We expected a pretty striking change in loneliness rates. And although we did see small increases in some of the data sets, it was nowhere near what I think many of us would have expected. And so yeah, the trajectories for each of these four buckets, these four variables are a little bit different, but one of the take-home messages for me was in some ways, at least looking at the overall levels, a surprising amount of resilience, at least given to what our expectations were based on our personal experiences and our anecdotal experiences through the first several months of COVID.
Yeah, I think that is one of the most interesting things that I took away from this paper too, from your work on this, was just that our intuitions, even as clinicians sometimes in this, were wrong in some ways, right? What we expected to see as these trajectories of just doom and gloom and bad news, didn't seem to pan out in a lot of the studies, which is good news, right? Like you said, that means that there was a lot of signs of resilience, that people sort of struggled in the beginning and then worked on ways to figure it out. And that didn't match up with a lot of the sort of narratives maybe we were seeing in the media or extremes. But even given that, I think that there are a lot of, as is our sort of focus in this episode in particular, like uneven effects of the pandemic. So the general trends seem to be that you all found in this work that, yeah, people struggled in these various domains, especially in the beginning, but that the extreme discrepancies didn't pan out the way we might have expected, but that's not the case for everybody. So I wondered if you could speak a little bit about, there were some populations you found fared much worse than others in the long term.
Certainly. So that is the next part of the paper. And yeah, the story of resilience, I think, is a really nice one, but I do think it masks, these overall levels mask a lot of really important individual variation and experience. So as you note, there were some groups that were hit particularly hard. Some of the differences, we use different types of data to try to understand who had been hit primarily especially hard during the pandemic. The brief answer is there are a couple new profiles of risk. And by that, I mean, some pre-existing mental health differences remained. So for instance, before the pandemic, we typically find that higher levels of income are associated with better mental health than lower levels of income. That difference remained during the pandemic, but there were some new risk profiles. So here's what I mean. Before the pandemic, typically there is a U-shaped pattern in life evaluations and age. So usually people are pretty happy when we start asking them independently in their teens and early 20s. It starts to decline during the 30s, in the 40s, and the 50s. People are in the lower levels of life evaluations, and then it picks back up through 60s, 70s, 80s, and so on. The pandemic changed that in ways we had not seen before. So this original U-shape of life evaluations over the course of cross-sectional data all of a sudden just became an upward slope. So where all of a sudden young adults, like starting in their late teens and through their 20s, were reporting very lower levels of life evaluation than we had seen before, almost, really changing this U-shape into a whole new structure. So that suggests that, these pre-existing differences are not just remaining, all of a sudden there are new risk profiles. So younger individuals is certainly one new risk profile. lifestyle. The pandemic often hit women in a harder way than men in many samples that came out, but also parents, especially in the early months and year of the pandemic. People with young kids at home, in particular young kids under the age of 5, this was the strongest effect. Emerging from a really fantastic paper by Pearson colleagues looking at a large data set from the UK, found that basically young female parents were all of like this nexus, these qualities. I have healthy children and family in town, and I remember feeling how stressed I was with my 2 young kids at home.
Yes.
I can only imagine people who don't have those supports or those luxuries. And so, I feel like I saw a sliver of that, and I can see how this rings true in so many ways. But that certainly did emerge in the data. There were also other new risk profiles. For instance, some racial groups were highly stigmatized especially early on in the pandemic. Individuals who reported being of Asian ethnicity were reporting lower levels of mental health, lower levels than had seen before the pandemic too. There was a larger gap, in part because, there was a lot of discriminatory action directed towards this group.
Yes, so much there. And I think especially the parts that you were able to pull out, that this is why we wanted to talk to you about this study, right, in this episode, for a lot of reasons, but especially that you were able to find or just sort of see this trend across a number of studies, not just one study, that parents, especially of younger children. So I think you especially talked about parents of kids younger than 5 years old, were hit especially hard, were one of these major risk profiles. And then if you layer on top of that the parent is young and female, that they were hit especially hard. It was like this sort of trifecta. And so I think that's something, as you said, also as a mom of a child that was in that age range, throughout this pandemic, that we knew if you asked any of us, like, this is really hard, even with many sort of layers of privilege and resources and, flexibility in our jobs, like this is really, really difficult and hitting us in a different way than maybe some others, in other life stages or circumstances. And so to have quite a few studies now also showing that, right? Showing that, yes, that we already knew that certain vulnerable populations in our society were going to be hit harder, by this for a lot of reasons, but now to have quite a few studies showing that, and there were some groups that we hadn't really anticipated would be hit so hard. So why do you think that especially, younger females who are parenting young kids were hit so hard?
Yeah, I think there are multiple reasons. And I don't know if one study has benchmarked any of these individual predictors against one another, but I don't know if that's relevant either. I mean, there are probably many explanations. A couple, I think, is childcare before the pandemic, and especially during the pandemic, fell very squarely on mothers' shoulders. Many families may have tried to adjust and find new ways of coping, but a lot of data suggests that it often fell disproportionately on women. There was also some data suggesting that just time use was very different for women and men. And women were doing a lot of altered hours and a lot of more juggling. I think there was a lot of extra strain on people's times on time in ways that we didn't see before. But also women tend to work in more healthcare professions or even more seasonal employment, types of work that were less certain, and people were struggling to the uncertainty about the next paycheck, their uncertainty about whether, cafes and restaurants, which were originally closed, will they be reopening? Or if you are in the service industry, you're just being exposed to more people at a time where there was a big scare about what might happen if you catch it. There were strains that were leading to more health complications and certainly more hospitalizations. And so working in these essential job positions were risky, and a lot of women were doing that. And it's not just women. I mean, there were also often people from minority or vulnerable communities who were working in these positions and had to go home and live with their families and live with the risk that they might be catching it and spreading it.
Yeah. What I also really appreciated in your discussion in this work were the recommendations you made. So, there were quite a few recommendations that your team pulled out, like for policymakers and, legislators and people funding various initiatives. So could you just give us a sort of kind of high level summary of what were some of those major recommendations based on, sort of surveying all this research?
Yes. So we offered 7 recommendations, and I won't rattle them off because I think they might be a little lengthy and not so exciting. But I think the first one was what we called something that was really urgent, which was just calling for more research into understanding how COVID was spreading, not just physically, but understanding what the biological and physical consequences were of catching it, but also just of being in an environment where all of a sudden you're dealing with this uncertainty and this fear of catching it. So really just calling for continued and ongoing research. And I think a lot of work has been done on that and continues to do so. I think we're still just starting to scrape the surface of understanding what catching COVID means for our long-term health and mental health, but also what that might mean for children, a decade or two from now, and for adults who have had to deal with all this in decades from now. So that was kind of our urgent recommendation. We had two short-term recommendations. One was suggesting that we offer more support and more monitoring for people who are either catching COVID, who have caught COVID, or who are at the risk of catching COVID. We haven't talked about this, but one thing we did cover in the paper is the fear of catching COVID or having caught COVID-19 was a pretty large predictor of a lot of negative mental health outcomes. And so I feel like the government here where I am in Canada was really tracking people pretty closely. There was a lot of testing and tracing in early days of the pandemic. A lot of it had to do with just like, were you in close contact? Were you in a restaurant or a space where you may have been exposed? All of that was great. But if people were, I think there was an opportunity, and there might still be, or a lesson for future pandemics here, is that if people are at risk of exposure, just even knowing that they've been at risk is a mental health burden. And so following up with these individuals and offering care and support, not just for their physical health, but for their mental health as well, and for the people in their close proximity is really important. And kind of the second short-term recommendation was to prioritize keeping schools and daycares open. And maybe this actually raises an important boundary condition or caveat I should have spoken about at the beginning. Our paper focused primarily on adults' mental health, but we still made this recommendation about keeping schools and daycares open, not even fully understanding the scope of what this would mean for kids. I mean, education and daycare settings provide so many important needs for young kids. Not only is it where many kids from underprivileged or challenging backgrounds get consistent food and care and support and keeps a lot of kids, from my understanding, but I'm sure you're an expert on this, when kids are in risky families or in risky situations, it's often one of the earliest signs of alert when
that's right.
Kids are attending daycare and school, one of the early signs. So pulling that away from kids probably has a number of really important consequences. We weren't even touching that. We were saying based on parents' mental health data, we should be prioritizing keeping safe access to daycare and elementary school, basically on account of what this is doing to parents' mental health. It's not to say, keep it open at all costs. I mean, if there are huge waves and people are dying, we need to make some important decisions. Right. But when we're deciding between nightclubs and schools, there might be a clear winner there. And then the additional recommendations are kind of ongoing, and they don't so much have to do with COVID, but they talk about how to make mental health care a bigger priority for people and how to support mental health beyond the pandemic. So taking this opportunity I kind of mentioned earlier, where mental health is now kind of receiving this greater attention than it had before, and rethinking how can we support people when they need it, and how can we preempt the fact that people might even be needing this support in times of need, and just help people live healthier, more secure lives in ways that they don't need to go out of their way to seek mental health care and support. It's just built into our worlds in ways that are not stigmatized and not challenging to access.
I really appreciated hearing from Lara about some of the more surprising or unexpected findings, as well as the ways she and her colleagues highlighted the reciprocal relationship between parents' mental health and stable childcare. Reviews like the one from the Lancet task force help us pull out important themes and trends across many studies to inform broader decision-making. So to continue the discussion of the uneven effects of the pandemic, I also spoke with Dr. Simona Skripkauskaite, a researcher working with survey results from thousands of parents and children throughout the pandemic.
So the Cospace study stands for COVID-19 supporting parents, adolescents, and children during epidemics. And it's basically an online survey-based study that's been tracking how parents, children, and young people have been doing across over the pandemic. How have their mental health difficulties and challenges changed month to month? So it's around 8,000, 9,000 parents that filled it out quite consistently and repeatedly, not necessarily throughout the whole period, but coming in and out at different times.
Which, if I could just include a quick sidebar for parents who might not realize, or any listener, like, that is an incredible sample. That is a lot of people. That is very, very difficult to continue to track people on a regular basis and have them stay engaged for that long. So I just want to give you huge kudos. I mean, that is an incredible amount of work, and it's really, really hard to track a sample that size for a long time, which is why we were such big fans of this study in particular. So I'm sorry, go ahead. I just wanted people to know, like, that's not typical, and it's incredibly difficult to do.
I agree. It's definitely not typical. And really all the credit goes to our participants who have been giving us their time and their willingness to do all this. So it's around 9,000 people who have been doing that. There's over 12,000 who actually have engaged with the study over different times. And these are mostly parents and carers of children, school-age children. So that includes children from 4 to 18 at the moment, but actually 16 at the start of the study. It's worth noting that because it's a convenience sample, and because, as I said before, we have mostly recruited people through basically spreading the message out there and inviting anybody who wants to take part, it's not a particularly representative sample. So the people are, mostly mothers, which is very common in any sort of research where we're collecting data from parents. They are relatively more affluent than general British population. They are more white as well. If anything, we probably have a slightly larger representation of those that have children with special education needs or neurodevelopmental differences. On side to that, we have also been collecting some data directly from the adolescents themselves. So the young people, around 1,300, I want to say, young people have been completing the surveys as well in connection to their parental surveys too.
Yeah, so let's talk about a little bit why that's the case. I appreciate you sort of recognizing and talking about, representative samples versus convenience. So let's break down those terms first. So what is a convenience sample?
So convenience sample is really a sort of sample where you will just be recruiting any volunteers that are willing to take part in the study. You might have some criteria, for example, that we want them to be of parents of children of specific age. We wanted, in this case, all of them to be from United Kingdom, because we have sort of partner studies and sister studies running that are doing similar things in other countries. So we wanted to control for the sample to come from one place. And really, beyond these few stratifications, it's quite an open call. So it's all the volunteers who might be generally more keen to take part in studies in some way or another. They might be more, have more time on their hands to do so. They might, be coming from research community themselves often. So there's a slight bias. It's a slightly different sample than, for example, taking anybody from the population, right? Mm-hmm. So if we look at obviously nationally representative samples, which is ideal in many cases, but has challenges on its own in terms of achievability as well as continuity in that sort of sense, that will be studies that are often conducted at the more global national sort of level. So a lot of official surveys that come from the government or any sort of statistical organizations that track people's mental health or health in general will be recruiting people in a more representative way. So that will mean either taking sort of stratifying, so putting these demands on what the sample should be more in line with what the population looks like in general, or, for example, taking the whole population if you have the contacts with everybody and contacting random number of people from that population to make sure that what you're getting in terms of the information is actually directly representative of the sizes of the community you're trying to tap into.
Right. And especially if you think about the kinds of information you were asking about, right? Really vulnerable things like our mental health, like the well-being of our children, things that might feel threatening to answer, like you said, if there's this sort of perceived distrust already. So yeah, I think that's really helpful to just sort of explain, like, why do some of these studies end up being made up of who they are, right? Even despite a lot of efforts to the contrary, or to try to round that out. So I think that's really helpful. So yeah, let's get to what you found. So talk us through some of the major takeaways.
Our main findings are that the story is quite different for everybody, right? So it depends on personal characteristics as well as this big context on how things have been experienced through the time. But if we're looking at average trends, really what we've seen is that there has been in both in parents and children a sort of reactive profile in terms that mental health difficulties have increased when the restrictions were highest. So when we were not allowed to go outside, when we were supposed to be wearing masks, when we were supposed to be social distancing, that's when we've seen highest increases in mental health difficulties, as I said, for both parents and children and young people. These difficulties then subsided and somewhat decreased when the restrictions eased, and sadly increased again when the new restrictions came into place at around Christmas time, in Britain at least, last year. That's sort of our average pattern. When we're looking at specifically what predicts those different patterns, what we can see is that this pattern, this reactive pattern, is much more pronounced for younger children. So in our case, that involves primary school age children, so those under 11 years old. So they have had a more reactive profile where the difficulties increased as restrictions were introduced. And the adolescents in our sample had a somewhat of an easier time. And again, the same thing applies to the parents. However, beyond that, we've also seen that there's particularly some vulnerable groups that have been completely differently affected by it. So children from lower income families and children with special education needs, as well as those from households with a single parent, have just seen a heightened, elevated levels of mental health difficulties throughout, or sort of first year of pandemic at least. So what that means is that for generic sample, difficulties decreased as restrictions started easing. That decrease was not seen in these vulnerable groups, meaning that these are the groups that particularly need attention and support.
Yeah, so the effects, I mean, that was one of the biggest things we wanted to sort of highlight in some of these studies for this episode, was that this was a story in many ways of these individual differences, right? That this has looked different depending on your particular circumstances. So it's hard to really craft a narrative, even though a lot of parents are asking that, for how this has impacted my kids. How has this impacted me, our family? Because it depends on a lot of things. So, I'm listening to this and I'm thinking, like, maybe a lot of parents do who aren't just plugged into the research world, right? Like, okay, so you did all this work, you followed these thousands and thousands of parents. Like, of course, we already knew our kids were struggling. We knew this was hard on us. Like, why do all this work to study something that seems so obvious?
Yeah, I've heard that before. That's a big issue of psychology, isn't it?
Right.
Because ultimately, it's for one a sign that we're doing it correctly. Because ultimately, psychology is a science of people's minds and people's lives. So if it is showing findings that are not relatable, something went wrong somewhere. And researchers in that case should look back and reassess and make sure that they have not made mistakes somewhere, because our findings should make sense to the general population. It should make sense and be relatable. But to that, in more generic sense, why research like that is necessary is that because there's such a variability in how people experience things, right? So we have billions of people on Earth. Every and each person has an individual story of what their experience has been through this. It so will depend. If you have, conversation with 5 people, you might have conversations with 5 people who had terrible time and have said one view, well, on the other hand, you might have the same conversation that the 5 people who had wonderful time and think that this has been a really good thing that happened. So what this allows us to do, looking at large samples like this, is to have some generalizability. It allows us to see how these individual experiences all marry up together. Are there certain patterns that are align the sort of general experience? How does it look on the average, as well as distinguish what are these individual characteristics that predispose one to have a harder or easier time. And in some cases, these characteristics are less individual but contextual. And that means these are things that we can interfere with in terms of the help we can provide. So these might be, the support that's needed. It might be treatments that are provided. So in the case of the Cospace study, this actually has led to few intervention-based research sort of studies as well. So we have had things like COCATS that has started and built on the Cospace research, which is anxiety treatment-based study in schools. We also had a Sparkle trial, which was aimed at supporting parents support their children with sort of challenging behaviors. So it was a parent-positive app that was providing advice and support to parents directly in response to basically what our participants have said in the Cospace study, as well as a CORE trial that is really oriented to teen mental health and provides support by collaborating with teens themselves. So it's sort of adolescents for adolescents type of support. So that's what these patterns that make sense to all of us allow us to do. It allows us to see a bigger picture and take action to change that bigger picture.
Yeah, I think that's a great explanation. It was sounding to me like, so if as a parent I say, well, yeah, this is just bad for all of us. We know that this hasn't been great. Okay, but there's a lot more nuance to that. And so what you have been able to do is dive into the nuance to recognize it wasn't necessarily bad the whole time at a consistent level. That fluctuated. It wasn't the same severity of bad for different kids and different families in different situations or contexts like you described. And it helps us, have the data to justify making these intervention suggestions, trying these additional studies and ways to try to address issues in real time. So it has to add those layers of nuance to be able to actively respond, in ways that make sense. Who is higher risk, who is lower risk, where should we put resources right away? So it was making me think, as you were talking about some policies that, a study like this really helps to support or justify. And so I wondered if you could speak a little bit to that as you think about what has come out of the Cospace study, or even some of these other studies that you're starting to understand and interpret. What suggestions for policymakers come from these? How should we be thinking about using these findings in really applied ways?
Yeah, that's a very good question, because that's definitely part of the reason why it's important to look at that. Definitely at the beginning of the lockdown, at least here, the conversations we've been having with politicians and policymakers have not necessarily meant that they have had same experiences. So if they would draw it on that, the policies put in place would not necessarily meet the needs of a variety of people. So having the politicians sort of have this research and evidence in their back pocket has allowed them to argue for, more support for lower income families, more support for single parent households, and all of those things. So really, all the politicians should have, an understanding of what's been happening, and luckily, that understanding is somewhat there now through repeated policy reports from studies like ours and our colleagues' studies all over the place, making sure that they are aware that these decisions that they're making in terms of school closures, in terms of lockdown restrictions, decisions of opening those things as well. So, for example, prioritizing opening of garden centers and pubs over opening of, for example, So before allowing the children to see their extended family, that might be actually the support the parents need, right? Because ultimately we're not made to parent alone. We need to do that with our support of our community. So making those decisions without necessarily consulting the parents and necessarily looking at the research means wrong decisions get made. So what these studies allow to do is inform them that children and parents are actually reactive to those decisions. The decisions do matter. They have to be taken into account when those decisions are made.
Right. And just thinking too about breaking things down. I mean, even when I was just thinking about lockdowns with school, like you were talking about prioritizing opening up certain kinds of businesses or parts of society over others, even making decisions about schools, your findings centered around this idea that in some ways younger kids struggled a lot more through that sort of pattern than older kids. And so, but I haven't really heard a lot of regions around the world making decisions like that, where it's instead just, we're going to open schools or we're not, rather than breaking it down to, well, we're going to prioritize primary grades because younger children are struggling more for these different reasons. And then maybe we have some more time before we open up, secondary schools, high schools, that sort of thing. But it isn't, decisions aren't being made with that level of nuance that I think a study like yours could actually really inform how to prioritize both resources, but also policies. Yeah, very helpful. Thank you. Anything I didn't ask that you want to be sure to talk about?
Well, I guess one thing was we've been looking at more than the children, right? We've been looking at parents themselves too. It's an important part of the story. This has not been happening to children in isolation. This has been happening to everybody. And this has been happening to a lot of people throughout. And what we've seen in a lot of other research is, again, a very similar pattern in many ways, where mental health difficulties in adults also increased and decreased in response of pandemics. It varies per study, per location, per time when people are looking at it. However, what we have seen is slightly beyond that. What does this increase basically risk of being a parent and this increased responsibility of not only having to handle yourself in the pandemic, but also be responsible for your little ones? What does that mean? And it's important for parents to note that they have not been alone in the situation. If you found it difficult, that's okay. A lot of people found it difficult. We have seen at the beginning of the pandemic that around 80% of parents in our sample were struggling to manage the needs of their child and the responsibilities at work. We were not made to parent alone. We were not necessarily signing up to be a teacher, a nurse, and all of that. I mean, to some degree, obviously, every parent is, but not to the professional. This is a full-time job.
24 hours a day, exactly.
Degree, exactly. That has been a struggle for a lot of parents when the restrictions were hardest. And that was the case in the first pandemic. It was the case in the second lockdown too. And it's important to take note of that and to step back and also sort of take care of your own mental health in the situation too. Because again, your mental health is likely to impact your child's mental health if you want to focus on sort of the negatives of it. But if you want to focus on positives of it, it's important that you're feeling well, and it's okay to be overwhelmed, and it's okay not to teach them a particular lesson a particular day, because actually big picture matters here.
That's right. Yeah, that's great perspective. Thank you. This has been an episode of the Pandemic Parenting Podcast. We'd love to connect with you via email or on social media. Follow the links in our show notes or look for our blue and yellow logo when you search Pandemic Parenting on Twitter, Facebook, Instagram, LinkedIn, YouTube, or TikTok. And this podcast isn't all we do. Pandemic Parenting is a 501c3 nonprofit providing free science-based resources for parents and all who care for children while navigating the COVID-19 pandemic. To learn more about our organization and access our extensive library of webinars, videos, blogs, and more, visit www.pandemic-parent.org. pandemic-parent.org. This season of the podcast is produced by Victoria Bruick, Carmen Vincent, and myself, Dr. Amanda Zelechoski, with strategic support from Dr. Lindsay Malloy and Pandemic Parenting's Executive Director, Jennifer Valentine. Many thanks to the Pandemic Parenting team for their work in making this show happen, including Miranda Dauphiny, Lydia Lang, Julianne Matthews, Mark Snow, and Paula Sillers. If you want to support the work of Pandemic Parenting, you can do so in a few ways. You can leave us a 5-star rating and review on Apple or Spotify. You can donate to our nonprofit at www.pandemic-parent.org/support. And lastly, and most importantly, you can share this episode with parents and caregivers in your communities. Until next time, thanks for listening, and please give yourself some grace today.